Welcome to our Wizard Social Hour presented by our partners at MedStar Health. May is Mental Health Awareness Month, and with us this time on this Wizards Social Hour presented by MedStar Health is Jim Soda. He is the Wizards Mental Skills Coach. And Jim, let's just first start there. What does that mean, that title, and how does it apply to the Washington Wizards?
Well, first, Dave, thanks for having me on. That's correct. The title is Mental Skills Coach. The idea is actually twofold. Mental skills, really how it relates to sports is really performance improvement. That's kind of like your step in the door. We actually have another person on the team, Stu Singer, who does performance improvement as well from a mental skills standpoint. I'm actually a licensed clinician and certified mental performance coach. And what that really means is that I kind of have the ability to do those mental skills, which is like focus, imagery, visualization, those type of things to help you on court. But the competency and the clinical skills to really focus on things off the court. And we talk about Mental Health Month, that's that role really. If there's anxiety, depression, life event, any type of crisis that occurs during the course of a year or off season, and that's with the team and staff. So a lot of times that comes from the performance aspect and then usually leads into something a little bit deeper. So that's why it's nice to have even both roles or the ability to do both, because a lot of times that mental health component comes from discussing any anxieties or concerns or things that you're struggling with on the court. And then I'm able to take that a little deeper if necessary.
So we're talking about sometimes it starts with maybe a game situation, and then it can develop into something more that, if I understood you correctly, that opens the door to maybe discuss other things that they need addressed.
Yeah, usually that's the case. There's a couple different levels of sports performance. From a mental skills standpoint, similar to physical skills, you can train yourself to get better at things, get better at dealing with adversity situations that you need to be mentally stronger at in order to perform well when the game's on the line, for example. Those same skills apply off the court, but sometimes there's a disconnect. Sometimes we get into our real life as opposed to our work life. You process things differently. It may all come from the same spot. It may not. But the idea is that you have somebody there to help you differentiate between the two if necessary, and then maybe clear one up to help the other.
So that cliche, it's all in the mind, is not a cliche. It really is in so many ways, and everything we do while we work on physical fitness and other things, so much starts in our minds.
Well, if you think about your day, everything starts and ends with your mind. From when you wake up, go, and then the last thing before you fall asleep. And it's even those two things, how you wake up and how you go to sleep, have a large impact on that day and the next day. Just those pieces of it. So all the stuff in between, we have very little control over, even if we have a plan, because I don't know how the rest of this day is going to go. I don't know how this interview is going to go. So you prepare and go from there.
Yeah, especially when I'm the one doing the interviewing. I don't know how this is going to go, but mental health is such a it's a blanket term, and I wanted to start with something that everyone can apply when we're talking about mental health. First of all, how do you know you might need help? That probably is the first hurdle you have to clear, because you might think you're all right. Are there warning signs people should be looking for that, I need to reach out here?
Well, I was thinking about the talk today, and I'm going to try and keep a comparison somewhat with physical health, because I do that anyways, especially with athletes. And this idea that we work out or exercise or do certain things throughout the course of our lives daily, or recommended to, in order to be preventative, improve your physical health. It's really no different with mental health. You just don't see it as well. So when you talked about help, there's two different things. There's your daily anxiety, whether it's anxiety, depression, things that happen that cause you to have a mood, dysregulation. It could be brief. It could be based on you're driving and somebody cut you off. It could be a disagreement with the partner at home. Whatever the case is, it may last a few minutes. That's not necessarily problematic. It's just part of going through your day, but it could make you anxious or depressed based on how that goes. The help part, or if it gets any further than that, is if those symptoms or if that feeling of anxiety, let's say we're talking about anxiety and you feel it in your chest, Or we talked about sleep. You're having trouble sleeping because you can't stop thinking about it. And that's having some type of disruption of your day in your interpersonal relationships, things like that. And you're starting to notice it, or somebody mentions it to you. Because a lot of times you don't realize this is happening. That's when you might look to seek help in their traditional sense of reaching out and talking to somebody to get through a moment of time or an external situation, things like that. But every day you could be working on making these things better with just some of the tips we've even talked about this month.
Well, that's a good point, because certainly right now we're all dealing with anxiety in some forms, and often just what starts out as normal anxiety can escalate. So as we just deal with that anxiety, as I know during the course of every one of these days, there's mornings you feel, well, this is going to be a good day, and then you hear something in the news and you go downward. So how do you deal with anxiety and make it something that doesn't control you, but you control it?
Right. And it's a great point, especially with what's going on now, because this is a new situation for probably most people. I mean, unless you were alive 100 years ago, or even the other situations like this haven't been this disruptive to our lives. So the thing about anxiety, it's a concern or worry or fear or something in the future that you don't feel like you have control over. That's basically what it is. And some people are more prone to having that more significant, different versions of it. So it makes it more severe. So just taking that out of the equation, general population, right? I'm anxious about my future. I'm not sure if my job is going to maintain. For us in this world, I never thought that sports would stop the way that it did. I'm in Florida right now. Disney's not open. That never seemed possible. All this is new territory. So it's normal to feel an added level of maybe stress or anxiety because you don't know what's coming. Some people might have their lives continuing to go on the same way because they've kept their jobs or they're just in the field, whatever it is, but you still can't go out and do things. So everything's different, and nobody can say what's going to happen next. So that in and of itself is anxiety provoking because you just don't know. So what do I do to deal with that? Again, it's similar tips that you've probably heard over the course of your life. It's kind of up to you in a sense to recognize that that's happening and go, well, I might have to do this a little bit more often. And what is this? This may be taking a walk, for example, when you're starting to feel an added level of that anxiety in your chest, or you feel like you've had an argument and you don't know why, or you're feeling more irritable. Breathing techniques, right? You may have used them, you may have never used them. Now's a good time to read up a little bit, develop a couple different breathing habits. So when those things occur, you're just going to say to yourself, all right, I'm going to go sit for 5 minutes, get away from this situation. And that situation is just in your house, and calm down. The quicker you can get out of something that's causing a disruption, bring yourself back to some level of homeostasis, the better chance you have of then moving forward and getting the rest of your day in order. But if you kind of live in that moment, if you keep CNN on all day or one of the news channels and just sit there and let it go, your brain's going to take that information in. So some people can process it better. Some people can't. Part of it's understanding how you do that. And that's actually an area where a professional can come in and help you, because you may not fully know how you process things. Talking about it out loud helps you do that. So having a conversation with a professional or writing these things down also give you some insight into yourself.
And this is where I think, knowledge is probably a power. I mean, I've dealt in my life with panic attacks. I've always tell people that understanding what the body is doing then suddenly makes that normal. And you realize, all right, that's just my body doing something, because there's the fight, there's the flight, and that type of response. And that's where sometimes if you truly understand what's going on when you have anxiety, that might help you. Is that a fair statement? Or
100%. And you I don't know how many you've had, but you might be able to attest to the fact that after the first one, you'll kind of understand or have a better understanding of what's happening. So I've had one as well. And at first you don't know, like it feels like you're going to die. And then if you can process through some of it, I luckily had some of the information in my head about what might be happening. It's an extreme worry about what's going on, or fear, or those things. But if you know it, you realize you're not going to what your mind takes you to. Like, I'm not going to die. This may be what's happening. So that breathing, which is very important, especially in a panic situation like that, to bring that level, that heart rate down. So the heart rate goes up, blood pressure goes up, everything goes up. Okay, I realize what's happening. Go through one of those processes to start to bring that down and bring yourself back to where you are. So then we move into different techniques, which you would call grounding. So that's, that's trauma work. And we have traumas throughout the course of the day. They're little T's, possibly, but that's a traumatic situation. What is grounding? What do you mean by that? It's recognizing that I'm right here, right now, talking to you. There's a computer in front of me, and this is all that's happening right now. Nothing else in the past, nothing else in the future, but we have to remind ourselves of that. And so the techniques that you use and that you've used may have helped you to this point. You could probably improve on them. As long as you keep doing them, what's helped you, that's going to help you manage what we're, I guess, referring to as mental health moving forward.
Yeah, well, and that's why I think it's important to talk about it, because when I experienced them as a 16-year-old kid, we didn't talk about mental health, and quite frankly, you didn't know. There was not a term, panic attack or that type of thing. So that's why every month should be mental health awareness.
It is in some way.
We're good news. We're hearing about, reopening in the society and certain things going through various phases around the country. But there's probably a stress with that. Do you have any advice for that transition? Because many people have been under a new normal, for lack of a better term, and then suddenly you're back out in that world that is a little scarier than it was a couple of months ago.
Well, it's the same thing. So going back to kind of the athletes and even this, I talk a lot about self-awareness. I don't know if we get better at anything without self-awareness. And it's a challenge for people to really understand themselves, both physically and mentally, what you're capable of, what you might need help with, where you are, just even in the age spectrum. I can't do things now that I could have done 10 years ago, and being okay with that. So when you're talking about reopening, everybody's got a different threshold, whether it's risk, reward, or whatever it is. It's understanding who you are, why you're going to do what you're going to do, how you're going to respond to it, how you're going to respond to other people talking to you about it. Is always the best way to approach anything. And so from a mental health therapeutic standpoint, it's my job basically to help you, help an athlete, help whomever understand themselves better. Break through some of those areas where, for whatever reason, you might be blocking or not. You don't want to hear that I act like this when I do this. That may not feel good at first, but it's essential for you to grow as a person and get better. So when you're going out, now you can go to a restaurant. Well, do I want to go to a restaurant? There's not a right answer. It's based on where you are in a risk level, where you are age-wise, where you are with, elderly person in your house or a younger person in your house. All those things are factors, and you're making those decisions based on what you feel comfortable with. But the most important thing is that you are comfortable with your decision. So that, when we're talking about going out, you're not going to make a right or wrong move. You're not going to go to a spot and if you catch coronavirus because you went, so you don't know that.
Right.
There's no way to know it. So going back and saying, well, I shouldn't have done that, which a lot of people do, there's no information to suggest that's the case. That all being said, there is information that tells you what your higher risks are, what your lower risks are, and then you make those decisions based on that on a day-to-day basis.
In short, there really is something to that. When we say gut feeling, that's probably connected to what.
Yeah, that's true. I mean, you have experience in your life that you've done certain things and you feel a certain way. Some people make decisions by logic a little bit more than gut, or vice versa. I have them both. Some things just haven't felt a certain way, so I don't do them. And then sometimes I need to really intellectualize something. Both of those can be defense mechanisms as well, but it's how I make decisions. And I know that. And I know how long it's going to take me to make a decision. Not every time exactly, but for a general amount. And so I know that about myself, and I'm comfortable with that. So when something is brought to me, I'll go, give me a day, or give me this. Let me go through this process. And then you make your decision. So
it's May, but as I said, we should be talking about mental health every day, every month. How do we continue to advocate that mental health is just a normal process for our well-being?
Well, it's funny, we're talking about it today. There's a month, it's my part of my having the opportunity with the Wizards, for example, is the fact that the NBA, put out a mandate essentially to have a licensed clinician being part of the team. And these are all advancements in mental health, and the sports are following suit. Baseball's had it for a long time, the NFL, things like that. So the recognition of what that is, and I was broadcasting in the mid to late 2000s, and it just was not this way when I was in sports when it came to mental health or even mental skills to a degree. So in a decade plus, the amount that's been improved upon is pretty great. Sometimes it doesn't feel that way. You want to sit there and go, well, it should be talked about more. It should be this. I think it's moving in a very positive direction. I think it's a difficult thing still for people to talk about freely and address. As you mentioned, when we were younger, it wasn't talked about as much. Now we're having a conversation on a platform where, large people can see it. And we're talking about panic attacks. That's a good amount of progress in a generation. And that's what's going to happen to the next generation and ideally to the next one. So maybe in 2 generations, it's not even going to be, they won't even need to have a month because it's so common.
Well, and that's a strong statement that we think of athletes as supermen, and the fact that it's an NBA requirement now, basically, that's another sign of progress.
Right. Well, it's safety. So sometimes, and I've worked in inpatient treatment for a large part of my career, and that doesn't mean that crises happen all the time. They're relatively, sparse in how often like a true crisis occurs. But part of this job is being able to deal with a crisis and know where to go, know how to manage it, keep your mood the way that mine currently is, even when stuff is falling apart around everybody. Because when something that is considered a crisis happens, people panic. Like it's a natural thing because it's so out of the norm, you don't know what to do. And the idea from even talking about normalizing anxiety or different things is that it's going to be okay. You do the same thing as a parent. Like you have to reassure your child that it's going to be okay because they're looking to you to see what's going on. And we all revert back to that when something's going on. That anxiety, you mentioned fight, flight, freeze, that happens when something threatens us. It's supposed to. So where do I go for safety? And that's what this is meant to be, especially just from a position standpoint. If something's happening, where do I go to get me back to a safe spot? I don't know what's happening. So ideally, through the course of a year, it's us having conversations about performance on the court, maybe how that translates a little bit off the court from a day-to-day standpoint. But if something more significant happens, we know that somebody's there to help direct it and make sure it doesn't get bigger than it needs to be.
Is there anything part of mental health you wish was discussed more, or you want to discuss right now? I mean, we mentioned panic attacks and we've talked about anxiety. Is there any other aspect that should be brought up more?
Well, I think this discussion, to me brings up this idea that, what is mental health? And immediately jump to things like anxiety, depression, then you get a little bit more significant substance use. All these, there's so many different factors that fall into mental health disorders. And I think people are a little bit maybe reluctant to talk about anxiety or depression because they think that they then have a problem. I mean, even with physical health, right? If you have something wrong with your heart, or you hurt your knee and then it's not fully rehabbed, I think most people think of it as I'm broken in some way. Yeah. And the fact is we talk about age too. I'm in my 40s now. It feels different than I was in my 30s, and it's supposed to. And so as life goes on too, you have different experiences, different events, and you take that in, and you're supposed to have some of these changes. So I think an important piece of it is that people understand and I don't want to say accept necessarily, but that it's okay. And you're supposed to feel these things throughout the course of your day and your life. Nobody goes through life without feeling some of these feelings on a day-to-day basis. And so just because you reacted poorly to something in a situation, and then you felt bad about it afterwards, and you might have felt bad for a couple of days because maybe somebody got hurt or died, that's supposed to happen. And I think you mentioned Superman a couple times. I don't think that's reserved to athletes. I think you and I have thought we should be able to do this through this, and if I don't, then I somehow am something. And that's not true. It's just what we tell ourselves. And those are the things that cause mental health issues, is when you can't get out of that loop. And you can't say to yourself, you know what, it's okay.
Anything, any way to maybe bullet point what you hope people get out of our conversation today that they should remember on a day-to-day basis, if we could sum it up, or because everybody wants a quick card they can refer to in their
Right?
daily life. So I want to give folks just if there's a few bullet points that you can remember as starting points to help in mental health.
Well, I guess we could start with, where we are now, as we discussed, with the current pandemic. It's okay to feel whatever you're feeling. It's okay to take a little extra time to make decisions. There's not a right or wrong thing. Get information, but utilize the resources that you already have within yourself, understanding yourself and knowing that you're going to learn. We're all going to learn. So when we talk about normalizing, everybody, yeah, there's different scenarios, but everybody is still uncertain about the future. So there is help, or an internal help feeling when you know that more people are going through the same thing. That's why there's groups for certain things. So that's number one, is understand that it's normal to feel this way. Number two, know that there is, help out there. I say help, but it doesn't need to be severe. You can reach out to a professional or even a peer or a friend just to keep that chat going, just to get your information, your thoughts out there. If you struggle even with that, writing it down, just knowing that you can find information to help you through this day to day, or if it gets more severe at moments. It's far more prevalent than it used to be. Those are a couple main things, and giving yourself some credit. I don't think people right now are, with the fear and all this other stuff going on, if you feel something that you consider mental health, that you are able to handle it. And by reaching out to other people and asking for help, that is handling and learning about yourself. But we all have these resources. So remembering and recognizing that you have the ability, everybody has the ability to move forward and learn more about themselves so they can help themselves and help others. And I guess finally, stay grounded. Stay in the present as much as you can. And whatever that means for you when it comes to breathing or meditation, or knowing that we don't know what's coming, but right now is all you have. So whatever way that you have figured out, whether it's writing something down or breathing or some of the things we talked about, taking a walk, bringing yourself back to the present is the most effective, immediate way to deal with this stuff.
Well, Jim Soto, it was great being in the present with you and discussing some tips and mental health and all the wonderful work you do with the Wizards. Jim, thanks so much for the time today. Dave.
Appreciate it. Thank you very much. I'm glad to talk about it.
Jim Soto, the Wizards mental skills coach, joining us on this social hour presented by MedStar Health.